In this video, I'm going to respond to this question about bias and performance ratings. I can't speak to trauma because I'm not a trauma psychologist and I'm not a person of color, but I can speak to techniques we use to reduce performance bias. So in my field of study, industrial organizational psychology, we are always looking at what is the best way, the most accurate way we can rate performance, and what are different techniques that we can train people to do to try to make sure they all have a similar frame of reference, that they know what the behaviors are, and that they're distributing the performance ratings fairly. Now, if companies use those, that is up to them. This book, Noise, is a technical read, but a good read on how, all the ways bias influences anything that has to do with human judgment, not just work, but also like court decisions and medical decisions. The main quote of the book is, "Wherever there is judgment, there is noise," and usually a lot more of it than you think. I have a training I give to leaders on techniques to try to reduce the bias and the noise, and some of them are even recommended in this book. The first step is always for leaders to be aware, acknowledge it's a problem, and care about it, and enforce an accountability among their supervisors to hold them to the standard of addressing their own biases. And there's been a lot of literature over the past 40 plus years of research on what is the impact of race on performance valuations, whether the ratee or the rater is black or white or other race groups. Most of them have been on black versus white. So I dusted off my textbooks again to answer this question, and I couldn't find a meta-analysis, a study of studies across these since 1985. And their finding there said that both black and white people tend to rate people of their own race higher than others, which would put white people at an advantage, right? Because most people in leadership positions are white, so they're going to be rating other white people higher. But there are other studies, not metas, metas are studies of studies, but there are other studies that suggest differently, even that sometimes black people rate white people higher than other black people, and that can be due to internalized bias. Now, there are techniques that we try to use to help reduce this situation, such as having behaviorally anchored rating scales. So rating scales that list specific behaviors that you have to see people do so that you rate them, and you're not just saying, yeah, that person gets a 4 or 5 because I like them. That you have to speak to the behavior. There can be observation checklists. There are other techniques such as having the raters rate independently before you have an aggregate, or rank ordering the ratings. One of the best trainings is frame of reference training, which is where you train the raters on what those behavioral checklists are to make sure they understand and have a similar frame of reference. Now, of course, people are still biased and people still lie, but human bias is a real pain.